Meanwhile, a top constitution bench headed by Justice K.M. Joseph is hearing a bunch of pleas seeking a collegium-like system of the Prime Minister, the Chief Justice and the Leader of the Opposition in appointing the Chief Election Commissioner as well as the other election commissioners, noting that the CEC should be a person with character. The top court mooted the idea of including the Chief Justice of India in the appointment process in order to ensure neutrality. Arvind joining us with the latest on that story. Arvind, it was interesting to see the Supreme Court's observations in all of this, talking about the need for a man with for a person of strong character, referring to a past chief election commissioner like T.N. Sessions, saying somebody like him is needed, and effectively saying a best man needed for the poll panel at what appears to be a difficult time.
Yeah, Ankita, Supreme Court Constitution Bench headed by Justice K.M. Joseph is hearing a batch of petitions that seek a system, a collegium-like system to be put in place for appointment of Chief Election Commissioner and also election commissioners. If you could see now, the election commissioners are being appointed by the President on the advice of the Union Cabinet. But that's where a batch of petitions has been filed in Supreme Court, wherein they ask the Supreme Court to constitute a collegium-like system comprising of Prime Minister and also Chief Justice of India, along with the Leader of Opposition, in order to ensure that the appointments are done in a fair manner and also to ensure that neutrality is complied with when such important appointments are put in place. So, in fact, during the course of the hearing, some strong observations have also been passed by the Supreme Court. If you could see, Supreme Court said that the CEC should be a person with character who cannot be bulldozed. That's something, a strong observation that the Supreme Court passed while hearing this matter. And the Supreme Court also highlighted the fact that a person like a T.N. Sessions happens once in a while. And also, very importantly, Supreme Court also noted that based on the data that the Supreme Court gave it to the both the petitioner and also the respondents in this matter, since 2004, not even a single CEC has had 6 years tenure, because as per the Constitution, a CEC can have a 6 years tenure provided he doesn't attain the age of 65. But the Supreme Court noted this fact: since 2004, there has been not even a single Chief Election Commissioner who has had a tenure of 6 years. And that's why the Supreme Court also underscored this point, that because of the short tenures, the independence of the CEC is also getting thwarted. And they also told that data, they also highlighted the data that between 2015 to 2022, that's 7 years in this government, in 7 years, almost there have been 8 CECs. And that's why the Supreme Court said that there has to be a mechanism put in place to ensure that the independence of the election commission is also protected, for which the center said that there is no constitution in the vacuum. There is no vacuum in the constitution over appointment of election commissioners and also the chief election commissioner. And central government said that presently the election commissioners and CEC are being appointed by the president based on the aid and advice of the Union Cabinet. So today also the Supreme Court will continue with the hearing on this very important matter.
Arvind, thanks so much for those details. Well, joining us on the program now, Dr. Subhash Salunke, former Director General of Health Services, Maharashtra. He was also a member of the National Task Force on COVID and a senior advisor with PHFI. Dr. Rajesh Parekh, Director of Medical Research, Jaslok Hospital, and the author of the vaccine book for COVID-19, also with us. Thank you both for joining us on Good Morning India at this point. Dr. Salunke, why is Mumbai finding itself in this kind of situation? Why should there be deaths due to measles, in 2022, honestly? And, there are accounts from families saying that some of these children were at least partially vaccinated. So what exactly is going on?
I think this is really a very unfortunate situation that children are dying due to measles, and that too in a city like Mumbai. However, one thing is absolutely correct, that is the Mumbai Municipal Corporation has a very strong and robust health system compared to many other municipal corporations and municipal councils throughout the country. That I'm 100% certain about it. And in spite of that, this is what is happening. It's primarily because of the social factors. Those wards which are impacted and affected during this present outbreak are highly congested. There is extremely high illiteracy. In one family, there are 7-8 children. Unfortunately, these are migrant population who are not ready, nor their leaders are ready for getting their children vaccinated. So there is apathy on the part of the community also. And at the same time, to reach this community in time for a proper surveillance. And the last point was about the kind of a downward trend of routine immunization due to COVID in last 2 years is definitely one of the factors responsible for the present outbreak. So social factors or socio-economic factors, no or partial immunization. And third, there is a malnutrition, severe. All the children who have died are highly susceptible because of their severe malnutrition that we have seen. They are all having the problem, no vaccination, severe malnutrition. One episode of a kind of a diarrhea or just developing pneumonia and child dies. That is the unfortunate part. And this has happened only in those localities where the health services couldn't really reach, or even if they reach, community did not respond. So there is a definite gap between what needs to be done and what has happened. And let us try and understand. Now we are seeing these cases in other parts of Maharashtra. At least in the state of Maharashtra, the surveillance system is reporting. Look at the northern states. Do you think that measles outbreaks are not taking place in northern India or southern India? It is, because COVID directly is responsible for downward trend of routine immunization throughout the country. And this is expected. It's not unusual. What we are seeing outbreaks in India of the measles is actually global phenomena. It's nothing. We have seen the outbreaks taking place in Africa. We have seen outbreak taking place even in the Europe and US. So under the circumstances, this is not a very unusual situation. Only thing is that how the health system functions so that children don't die. Mortality is avoided, and that need to be jointly done by the municipal corporation health system, the community, the parents, the CBOs, the NGOs, if all come together. But right now, there is a downward trend, and that's a reassuring situation as far as Mumbai is concerned. I'm not really that worried for Mumbai. I'm worried for other, whether it's Malegaon, whether it is Nashik, Bhiwandi. These are the places where the health systems are comparatively weaker. And I'm more worried about those states where their health systems are definitely not up to the mark. And that is the situation. And these outbreaks are going to continue. This situation, till the time we reach at least 90% vaccination status for measles throughout the country, we can anticipate such kinds of outbreaks.
Right. Dr. Rajesh Parekh, is that an assessment that you agree with? And is it really sort of just low levels of vaccination problem, or is it more? Has malnutrition been a bigger factor? The fact that this is happening in sort of closed clusters in a way, can the BMC actually sort of take steps to try and crack down on measles in these areas? Because it really isn't that widespread.
Good morning, Ankita. I think that was a fairly comprehensive coverage of the situation in the city. Just to add a bit of a national and global perspective to what has already been said, the vaccination rate, the coverage for measles in our country is rather low. It hovers around 66%. So there's a long way to go in the national coverage. But globally, in the first 2 months of this year, of 2022, there has been a doubling of the cases of measles compared to what was there in the same 2 months in 2021. And of course, this can largely be attributed to the paucity of vaccination due to the focus on COVID-19 and the fact that, families were not ready to take their young babies into hospitals to get immunized. There have been outbreaks around the world. Again, to give you an example, in New York City in the summer of 2019, schools had to be shut down because of an outbreak of measles, which started with only one unvaccinated child who had returned from Israel and infection and brought it. Because measles is so contagious that in New York, it spread rapidly to almost 700 children, and the schools had to be shut down. So it's understandable that in the closed clusters that you alluded to, and of course, malnutrition and the low vaccination rate, that's a perfect storm. I mean, that's a constellation of factors which is going to give rise not only to measles, but possibly other diseases as well. We had warned in the vaccine, in the COVID-19 book, which we wrote in January of 2020, that in the wake of the COVID-19 pandemic, there would be other diseases. We didn't focus on measles, but there would be diseases for a variety of reasons, which have already been alluded to. The second part of your question, what can the city do? Well, the most important thing, of course, is to ramp up the vaccination. That's the only thing that's known to prevent measles. There are no specific treatments available for measles anywhere in the world other than symptomatic treatments and greater awareness. Now, we must, on the other hand, compliment the city. They have covered almost 25 million individuals in terms of surveillance, specifically in the E ward and other areas which are affected. So I think we're doing what we can. There's nobody that can be blamed unless one wants to blame the COVID-19 virus, the SARS-CoV-2 virus. But in the situation that we're in, I think we should take solace in the fact that this is happening around the world and do whatever we can today to contain the outbreak. It's not yet an epidemic, but to control this outbreak and with greater surveillance and greater vaccination.
Right. Dr. Salunke, you think that's really where this should be going? Should we be looking at ramping up medical facilities for the hospital beds? I know some of it has already happened, but does Mumbai need to be in a state of readiness for more cases?
I think that is one part of it, but please try and understand. The measles outbreaks are an pointer, it's an indicator, it's the tip of the iceberg. The ills of the public health system in this country is, there are many. One of the major ills is that the politicians, the bureaucrats, and those who are supposed to be decision makers, unfortunately wake up only when there are deaths. See, we responded very well for COVID, but after COVID, the health system's weakness in the entire country is the major worry. So you get the outbreak of the measles today, and there are now outbreaks of the dengue in Delhi, in UP. So what are we looking at it? Why do we allow such outbreaks to take place? Why we are not focusing on primary health care? Why we are not focusing on the surveillance part? Why we are not focusing on the developing laboratory capacity? See, our country, we use a lot of rhetoric that we are becoming superpower, this, that. I know I visited many states, and the health systems of most of the states is in a neglected situation. And unless we strengthen the health system, every component of that, such episodes are bound to occur. And what we are going to do is just what we call as a superficial kind of an approach. Vaccination is definitely, but why can't we have a routine immunization program in the entire country, particularly focused in vulnerable pockets? What we are getting outbreaks right now in the vulnerable pockets. Why can't we have a health system of a municipal corporation, not only of Mumbai, Delhi, or every municipal corporation, so that the surveillance brings out the likely or potential outbreaks, and at the same time, we nip it in the bud. And for that, what is needed is a strong public health system coupled with the inputs from the private sector. And our country is really not up to the mark. So let us accept that. Right. We don't like criticism, and this criticism is a very positive one. Unless Government of India and the state government give priority to public health systems, communicable disease control, non-communicable disease control, primary health care, these types of episodes are bound to occur. And till people don't die, the politicians and bureaucrats may not be that interested. That is the unfortunately a bitter truth as far as the public health of this country is concerned.
In news coming in from Gujarat, the BJP has gotten tough on rebels. 12 more rebels have been suspended from the BJP. These rebels were contesting against official candidates of the BJP. Wagodia's Bahubali MLA Madhu Srivastav is among the suspended rebels. Earlier, 7 rebels had been suspended. So far, it's a total of 19 leaders currently suspended by the BJP. Meanwhile, Prime Minister Modi is going to be back in Gujarat today as hectic campaigning continues ahead of the assembly elections. He is expected to hold rallies in Mehsana, in Dahod, in Vadodara and Bhavnagar as well. BJP chief JP Nadda will be holding a grand public meeting at the Jini Gadhada Assembly. Former cricketer Harbhajan Singh is expected to campaign for the Aam Aadmi Party's candidate in Sabarkantha district. Let's take you through the highlights of the Gujarat high voltage election campaign yesterday, where all three big leaders have been crisscrossing the state for roadshows and public meetings. Rahul Gandhi making his debut on Monday in the Gujarat election campaign, and NDTV found a high decibel election campaign in Surat's Mahua, an Adivasi dominated constituency.
So, this is the situation on the ground. This is the reality on the ground, where all the parties, including the Congress, the Bharatiya Janata Party and the Aam Aadmi Party, of course, are trying to woo the voters, and especially the tribal voters, because that forms a major chunk of the voters in the state of Gujarat.
80 kilometers from Surat lies Anaval, a tribal-dominated village in Mahua, a constituency reserved for tribal candidates. Rahul Gandhi campaigned in this village, while Prime Minister Modi addressed a public meeting about 50 kilometers from here. But away from the high decibel election campaign, women in this village say they haven't got toilets under a government which the BJP lists as one of its big successes. Even in 2022, many women and girls here are forced to defecate in the open, a threat to their safety and health. 54-year-old Usha Ben hasn't had access to a toilet here her entire life.
तो माता जी, आपको अगर जाना होता है तो आप कहाँ जाते हैं, कैसे जाते हैं?
बाहर जाते हैं।
बाहर मतलब जंगल में?
जंगल में।
सरकार जो है यहाँ पे, उसने सुविधा नहीं दिया है वॉशरूम का?
नहीं दिया।
कोई लोग को दिया है सुविधा, कोई लोग को नहीं दिया है ऐसा।
Bhavan and Mandya Ben describe the ordeal they go through and question the government.
हमारा तो खुद का बनाया है, कोई सरकार ने हमको कुछ दिया ही नहीं।
नहीं, आपने अपने पैसे से बनाया है?
हाँ, हमारे पैसे से बनाया।
तो यहाँ जो भी घर हैं, जो ये आदिवासी डोमिनेटेड एरिया,
तो मैंने भी तकलीफ की है, पर मेरे खुद का बनाया है, सरकार ने कुछ दिया ही नहीं।
और आप लोग महिलाएं हैं, महिलाओं को और भी दिक्कत होती है।
हाँ, दिक्कत तो पड़ती है, पर क्या करें, मजबूरी।
Fearing for their safety, some families have built toilets with their own money. They say repeated requests to the MLA, who's from the BJP, went unanswered.
सरपंच देता है, किसी को देता नहीं, किसी को देता है, ऐसा करता है, दो पक्ष चलता है, तो ऐसा है।
नहीं तो आप लोग के यहाँ पानी आता है, नल है?
हमारे यहाँ नल नहीं आया।
नल नहीं है?
हमारे नहीं आया, नल नहीं
आया, लाइट नहीं आया।
अंदर गांव में जाता है ना, वहाँ तो कुछ ईंट रखी है, अमुक तो ऐसे गड्ढे ऐसे ही है,
खोद के चला गया, ऐसे ही खड्डा खोद के चला गया।
We asked the Sarpanch, who's with the BJP, but Manjula Ben Patel rebutted the charges of the villagers, saying all houses have toilets under the PM Awas Yojana.
हमारा स्मार्ट गांव है, कोई ऐसा घर नहीं है कि शौचालय नहीं है।
एक भी घर नहीं है जहाँ बाथरूम नहीं है?
नहीं, ऐसे बात ही नहीं हो, नया घर बनाओगे इसमें नहीं होगा।
नहीं, बट हमने तो दादा बहुत सारे घर देखे जहाँ नहीं है।
नहीं, सब घर में है। तुम यहाँ ये मोहल्ले में तुमको मैं घर पे लेके जाता हूँ, सब घर में शौचालय।
आपका बेटा?
But contrary to the claims of the Sarpanch, several houses we checked didn't have a toilet. Now even the next generation says that they're used to it.
तो ये भी बच्ची बाहर जाती है?
हाँ। ये आबादी जाए रास्ता ने पहला साइड।
तो सरकार ने बना के नहीं दिया अब तक? क्यों?
The
government has been saying that they have, ensured that there is no open defecation. But what do people do when they do not have any money and when government doesn't give them any basically resources to make a washroom? And this is the area, and this speaks for itself about the reality on the ground of this Adivasi village where Rahul Gandhi was campaigning today, where Narendra Modi, just 50 kilometers from here, Prime Minister Narendra Modi is campaigning. But on the ground, the reality is that people do not have access to even the basic of facilities. With camera person Ravi Joshi in Araval, I'm Tanushree Pandey for NDTV.
Weeks after Congress leader Shashi Tharoor lost elections to become party president, he's on a 4-day tour of northern Kerala, meeting political leaders and giving talks. He even met leaders of the Muslim League at Malappuram, a key Congress ally. But sections of the state Congress are upset, calling Tharoor's visit parallel activity. Sam Daniel joining us with the latest on that. Sam, what's expected today?
Ankita, we come to you from the Bishop's house at Thalassery in Kannur district, where Shashi Tharoor is on a breakfast meeting with the Bishop, after which he would be visiting the local Congress office, visit a family of a Congress functionary who died recently before addressing a talk. In fact, this is the culmination of his 4-day tour of northern Kerala. He began from Kozhikode, travelled to Mahe, Malappuram, and now he is winding up at Kannur. This is being seen as an attempt by Tharoor, who unsuccessfully tried to become the president of the Congress, to establish himself as a mass leader in Kerala, particularly having in eye the 2026 assembly elections in the state. In the elections last year, the Congress suffered a huge setback as the ruling left government under Pinarayi Vijayan won a second term. And it's only for the first time in 70 years the Congress could not capture power. The trend here is every 5 years there's a change in guard. And now with leaders like Oman Chandy and A.K. Anthony not so active, many look at Shashi Tharoor wanting to capitalize that kind of a vacuum available in Kerala to project himself as a mass leader. He is meeting political leaders, community leaders, so that he'll be able to get access to those large vote banks. And many also say after Shashi Tharoor's contest to become the Congress president, his stature has become big and he has a larger connect with the youngsters, the middle classes who want a change. And politically they say the Congress is desperate to win the assembly elections this time, and the present leadership in the state here, they say, isn't strong enough to take on the ruling left in the government. Already some sections of the Congress in the state have called this as a parallel activity, but Shashi has said he's only trying to strengthen the party. He has not said his aspirations is to become the chief minister or to become the party leader in the state, but he's slowly going towards that. But given the fact that the state is known for factionalism, the road ahead may be quite difficult, but we'll have to wait and see what kind of a response he would get in the Congress office he'll be visiting later today. He'll also be addressing a talk on democracy, secularism, and on the Nehruvian model. In fact, these programs were originally organized by the Congress, but later, what they call as under party pressure, it was withdrawn, and then through other organizations, Shashi Tharoor is making these talks.
All right, Sam, we leave it at that for now. Thanks very much indeed for joining us with these details. That's it on this edition of Good Morning India, but stay tuned to NDTV 24/7 for all the latest news updates.